Hello, this is a presentation on integrating trauma care, specifically eye movement desensitization, sensorimotory psychotherapy, music therapy, and trauma-sensitive yoga. In this presentation, I will discuss integrating trauma care, discuss the four modalities, eye movement desensitization and reprocessing, or EMDR, sensorimotory psychotherapy, music therapy, and trauma-sensitive yoga in more detail. Discuss populations and disorders these therapies are appropriate for, discuss variables associated with integrating trauma care, and what a possible integrated trauma session might look like. I'll discuss biblical integration as well as topics for consideration in future research. We begin with a discussion of integrating trauma care. EMDR, sensorimotory psychotherapy, music therapy, and trauma-sensitive yoga. Why should we consider integrating trauma approach? Well, complex trauma often benefits from more than one therapeutic approach. Integrating evidence-based therapies with holistic body-centered treatments could create full-body approaches that address the emotional, cognitive, and somatic aspects of trauma. Wadden et al. Found that while evidence does support the current psychological evidence-based interventions like EMDR as effective, research is also suggesting further interventions should be considered. For the purpose of this presentation, the following definitions will be used. Trauma. An individual trauma results from an event, series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening, and that has long-lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual well-being. That's from SAMHSA 2014. That's a well-vetted definition of trauma that allows for a vast exploration of treatments. For EMDR, I utilized a brief description from its founder, Dr. Francine Shapiro. EMDR, a widely accepted, research-supported, effective treatment for trauma and other life experiences. That's from her book, EMDR, a breakthrough therapy for overcoming anxiety, stress, and trauma. Sensorimotory psychotherapy is a body-oriented method that integrates physical, emotional, and cognitive aspects of experience within a framework supported by neuroscience theories of attachment and dissociation. That's from Buckley et al. The National Center for Complementary and Alternative Medicine defines yoga therapy as a mind and body practice with origins in ancient Indian philosophy. The various styles of yoga typically combine physical postures, breathing techniques, and meditation. Studies have suggested possible benefits of yoga for several aspects of wellness, including stress management, mental and emotional health, promoting healthy eating and activity habits, sleep, and balance. Wigram et al. Found that music therapy is the use of music in clinical, education, and social situations to treat clients or patients with medical, educational, social, or psychological needs. Let's take a closer look at these modalities individually. Like previously mentioned, EMDR is a psychotherapy developed by Dr. Francine Shapiro. It is a widely accepted and research-supported PTSD trauma treatment. However, one of EMDR's strengths lies in its versatility and effectiveness in a variety of adverse life events. Shapiro describes the use of EMDR as an appropriate therapy for those who find the memory or emotion of an event has not been appropriately processed in a healthy, adaptive way and is stuck and in need of transfer assistance. EMDR is a bottom-up approach, meaning it focuses on how physical and emotional sensations are stored in the body and nervous system. It works at reprocessing cognitions from a physiological level, including distressing images and the associated emotions. EMDR attempts to process distressing memories and shift the negative beliefs. Per Shapiro, EMDR uses the adaptive information processing model to identify memories that are stored in the wrong form of memory, areas that are keeping those memories locked away from memories that would help rationalize an event for someone or give hope for healing. EMDR is nationally recognized as an effective treatment for both PTSD and complex PTSD and endorsed by the World Health Organization, the American Psychiatric Association, the National Institute for Health and Clinical Excellence, and the Department of Defense. With evidence of its effectiveness in a variety of both physical and psychological disorders, Shapiro noted that the conditions do not only have to meet diagnosable criteria for EMDR to be an effective treatment. Shapiro found that EMDR was effective for anxiety, panic disorders, depression, eating disorders, and obsessive-compulsive disorders. Romero et al. Found randomized controlled trials supported EMDR for bipolar disorder, psychosis, unipolar disorder, depressions, phobias, obsessive-compulsive disorder, panic disorders, alcohol dependency, and pain management. Other possible applications include grief, insomnia, chronic pain, phantom limb syndrome, burn survivors, substance abuse. Again, EMDR is a widely effective treatment and can be used in both recent and distant events, chronic and habitual disorders, and appropriate for all gender and age groups. EMDR is an 8-phase structured therapy that uses simultaneous bilateral stimulation and should only be done with a specialized licensed therapist, preferably also one who specializes or is trained in an area of specific concern a patient is seeking care for. EMDR also has several benefits that classic psychotherapies currently don't offer. For instance, EMDR can usually process a specific memory in a relatively short time. Shapiro found that EMDR has been successful in as short as 1 to 3 sessions. APA points out that EMDR differs from other evidence-based currently used in trauma treatment, in that EMDR does not include extended exposure to traumatic memories. It does not require detailed accounting of an event. It does not challenge dysfunctional beliefs. Does not include homework. It can be conducted on consecutive days, and it's showing benefits in fewer sessions than other traditional therapies. Next up is sensory-motor psychotherapy. Sensory-motor psychotherapy, or SP, was developed by Pat Ogden after being influenced by earlier work with Hakomi bodywork. Ogden's early career was with teaching music, dance, and yoga at a psychiatric hospital, and according to an interview with Ogden, this is where she noticed how the body interacts with healing and the importance of bodywork in trauma therapy. According to the Sensory Motor Psychotherapy Institute, Ogden continued to pursue her interest in trauma, movement, and posture after work with sexual abuse survivors. Buckley et al. Describes SP as a body-oriented method that helps foster resilience by focusing on how feelings, emotions, and thoughts are all connected. Like EMDR, SP uses a somatic-oriented approach to address underlying causes in not just the nervous system, but in the body itself. SP works to restore regulation by resolving stored bodily tension. And like Buckley et al. Found, the body works as one cohesive unit. So when one part of the system is under stress, the whole system is affected. In sensory-motor psychotherapy, the therapist acts not just as clinician, but also as a bit of an investigator. The therapist observes the client for their physical responses, and then the goal is to bring that awareness to this response. Fisher knows that it's the mindfulness that is the priority and not the interpretation, so that a client can move from a place of reaction to a neutral observer themselves. Several journals have looked at the effectiveness of SP on managing dysregulation, with Gladstone finding it can help develop healthier responses regardless of trauma origin. Fisher found when SP was used to aid traditional therapies, it worked well for not just PTSD, but for other mental health disorders and the associated secondary symptoms as well. Adrian et al. Found SP even effective in group settings for things like complex PTSD. SP, being a somatic holistic treatment, can create deep and personal connections between therapists and clients, with Gladstone pointing out it also allows for more creativity and spontaneity in the treatment process, as well as having protective factors from re-traumatization. Music therapy. The National Center for Complementary and Integrative Health, the NCCIH, refers to music therapy as a psychological approach. The Cleveland Clinic states that music therapy can be used to reduce stress, improve quality of life, and when utilized with a qualified music therapist, can be a valuable complementary therapy for a variety of mental, emotional, physical, social, and/or cognitive disorders. The National Institutes of Health research shows that several mind and body practices, including music therapy, can be helpful in a variety of conditions, including, but not limited to, anxiety, depression, chronic pain, dementia symptoms, mood disorders, traumatic brain injuries, a variety of medical conditions, and trauma. Music therapy also has very little limitations. It can be used with any gender, any age group. It's not limited by location, musical background, or developmental level. Duffy et al. Found that music therapy is particularly useful in patients with neurodegenerative disorders and those unable to communicate in traditional language-based psychotherapies. Last, a look at trauma-sensitive yoga. TSA is an evidence-based treatment combining aspects of traditional yoga with a bottom-up somatic psychotherapy using a body-based approach to trauma healing in conditions like complex PTSD and PTSD, finds Dietrich. Park found that trauma-sensitive yoga can be utilized as both a preventative tool, a standalone therapy, and/or a complementary therapy for evidence-based psychotherapies and psychiatric approaches. Trauma-sensitive yoga also uses a somatic holistic focus to regulate the nervous system's response to stress. The NCCIH classifies yoga as a psychological physical combination approach. Research from McQuaid found that yoga suggests it helps users perceive stress in a different way, which in turn helps regulate the stress response system. This regulation brings a reduction in heart rate, lower blood pressure, and eases respiration rates. Taylor et al. Found that there's evidence that yoga, which combines physical activity with mindfulness, is helpful in multiple symptoms such as stress, anxiety, and conditions like PTSD. Per the NIH, yoga may relieve stress, support good health habits, help find balance, improve sleep, improve emotional health, improve mental health, bringing improvement to the overall wellness of those who utilize it. Zachariah et al. Found that yoga is possibly even positively impacting the immune system response when used in conjunction with traditional psychotherapies like CPT. TSA can also be used in a wide variety of populations, such as first responders, military, sexual assault survivors, men, women, and children, just to name a few. Trauma-sensitive yoga can also be used for many conditions. Park found that yoga is a viable complementary treatment for things such as anxiety disorders, depression, OCD, post-traumatic stress disorder, and eating disorders. In an interview with a trauma-sensitive yoga instructor, found that trauma-sensitive yoga participants reported feeling empowerment and reconnection with their own body after an 8-week course of TSA for sexual violence survivors. McQuaid found that the 42nd Surgeon General of the U.S. Army felt so strongly in the benefits of yoga, he made it his mission to bring yoga to the military healthcare system, both as a therapeutic tool and a preventative care tool. Braun found that the VA and Department of Defense have begun to utilize TSA, especially in women-only settings for military sexual assault survivors. TSA may be appealing to those adverse to traditional therapies. Park found that yoga may be an appealing option for those resistant to utilize traditional psychotherapies and/or psychiatric medications. Yoga is an affordable option. It's readily found, and TSA practicing instructors are becoming more popular. Park also found that stress reduction from yoga improves emotional regulation, capabilities, better social connections and support, and deeper spirituality. Here we have a breakdown of the different population all the treatments are found useful for. EMDR is found to be effective in individuals across all lifespans and is not gender specific. It can also be used with the visually impaired when bilateral stimulation is audio-based. Sensory motor psychotherapy is currently used for adults, with creator Dr. Pat Ogden currently in development of an SP for children, adolescents, and family members. Music therapy can also be used for all age groups across the lifespan, nor does it require a musical background from its participants. It's been noted that it's been useful in the geriatric elderly population and with cognitive disabilities. Trauma-sensitive yoga is also appropriate for all age groups across the lifespan, with consideration for mobility and injuries as needed. Conditions that EMDR is effective for is wide as well, including anxiety, trauma, mood disorders, depression, addiction, grief, medical, and physical stress. SP works with intrusive symptoms including numbing, detachment in the nervous system, dysregulation per Fisher, and also works well with secondary system disorders including eating disorders, self-injury, and suicidal ideations. Music therapy is a valuable complementary therapy, also found to be good for trauma, mood disorders, chronic pain, burn survivors, substance abuse, dementia, and traumatic brain injuries. Trauma-sensitive yoga can be used as a standalone or a complementary practitioner-led trauma therapy. Good for anxiety, depression, stress, PTSD, and victims of sexual assault. It should be noted when used with victims of sexual assault, certain modifications should be used to ensure feelings of safety. Variables associated with integrated trauma care. Because trauma care is often complex, it stands to reason that treatment could benefit from integration of more than one approach. Integrating trauma care can create a personally tailored treatment plan to each client's healing journey and process. When you combine bottom-up with top-down modalities, it can allow for the full emotional, cognitive, and somatic aspects of trauma to be cohesively addressed. What might a treatment session look like when we integrate these four modalities? Well, a possible integration might look like Phase 1, music therapy and trauma-sensitive yoga. The goal would be to stabilize and ground a client and create a sense of safety for a new patient. We could do this by utilizing trauma-sensitive yoga with grounding poses, and then with music therapy to help anchor into the present. Phase 2, we could use sensory motor psychotherapy. The goal would be a somatic exploration, observing how the body tells its trauma story. The intervention would be using SP to track these movements, recall the yoga practice from earlier, and explore the actions the body wants to take. Phase 3 could be EMDR with music. The goal would be to reprocess and desensitize these traumatic memories. The intervention would be, while in a stable position from the previous steps, introduce the EMDR with bilateral stimulation. You could also utilize bilateral music, which could possibly further calm the nervous system. And we would conclude with Phase 4, yoga and music. The goal would be to safely end the session and restore regulation. The intervention would be to complete with restorative yoga poses and calming music to further settle the nervous system. Biblical integration. Philippians 4:6-7 encourages prayer over anxiety and to receive peace that guards the mind even in difficult times. Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. and the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. Alcantara found that regarding spirituality, existing research is showing how it can positively influence the mental well-being and health by being a guiding force, providing resilience and creating a sense of meaning in people's lives. Casala found that both yoga practice and spirituality are linked to these positive mental health outcomes. And the Bible calls on us to meditate on the Lord's words, that we may be closer to Him and His ways. Cause me to understand the way of your precepts, that I may meditate on your wonderful deeds. Psalms 119. Trauma-focused yoga is a mindfulness activity that can help with spiritual awareness and realigning. Terence describes meditation as the activity of calling to mind and dwelling upon to apply to oneself's understanding about the ways and wonders and promises of the Lord, an activity of holy thought purposely performed before God, with God, to be one with God. Be still and know that I am God. Psalms 46. As Christian counselors, our role is not simply to ease suffering or reduce symptoms, but we are called to service for a greater healing and help clients reconnect with our Father so that He may carry the heaviest of our burdens and we may be restored in Him. Holistic treatments can be incorporated into Christian worldview easily as they allow for deeper, more intimate connections, room for spiritual growth, and provide a safe space for religious conversations when appropriate.